Thanks so much for coming to the new clinically useful journals list for PubMed searching, where to find it and how to use it. My name is Erica Lake, and I'm the Medical and Academic Library Outreach Coordinator for Region 6 of the Network of the National Library of Medicine, and I'm going to be your host for this session. We've got just a couple of things to cover before we get to our presentation. Everyone has been muted to limit the background noise, but we do welcome your questions and comments at any time. Please use the chat function to share your comments and use the Q&A function to submit any questions you have for our speaker. Miles Dietz-Castell, Region 6's Communications and Finance Coordinator, is providing our production assistance today, and he's going to be keeping an eye on your post with me. We will queue up your questions as they come in and save them for our speaker to address at the end of her presentation. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. Closed caption is trying to be enabled here. We should be available shortly, I hope, and you can get to that by clicking on the icon with the 3 dots and then selecting closed caption. We are recording today's presentation, and we will post it on NNLM's YouTube channel in 1 to 2 weeks. At that time, everyone who registered for this session will receive an email from us with a link for the recording, so keep an eye out for that. This webinar is eligible for 1 Medical Library Association continuing education credit, which you'll be able to claim through the evaluation link we share with you at the end of the session. And speaking of that evaluation, your feedback really matters and it helps us improve future training, so please take a moment to complete it. Since some of you might be first-time attendees to one of our webinars, I'd like to share a few words about who we are. NLM, the National Library of Medicine, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. NNLM, the network of the National Library of Medicine, is an outreach program of NLM working to ensure health professionals and the public have equal access to health information. NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to connect with your regional medical library or learn how to become a network member, you can check out our website at nnlm.gov. So today's session was organized by Region 6 as part of our Speaker Spotlight series. This series features expert guest speakers presenting on topics of interest to all of our users, which include librarians, public health practitioners, educators, clinicians, and others who work with health information. These presentations are scheduled intermittently throughout the year, and you can learn about upcoming sessions by checking out NNLM's training calendar or by following your regional medical library's newsletter, blog, and social media posts. All right, so it's my great pleasure to introduce our speaker for today's Speaker Spotlight. Michelle Klein-Fedician is a liaison librarian to the School of Pharmacy at the Health Sciences Library System of the University of Pittsburgh, where she works with the Transitional Year Residency Program and teaches infectious disease residents and clinical research students. She is also a faculty member at the University of Pittsburgh with the title of Research and Clinical Instruction Librarian. In addition to holding a Master's of Science of Library Science from Case Western Reserve University, Michelle is a registered nurse with a Bachelor of Science in Nursing degree from the University of Pittsburgh. She is a fellow of the Medical Library Association and distinguished member of the Academy of Health Information Professionals, and has numerous grants, awards, publications, and presentations among her accomplishments. So welcome, Michelle. I am now going to turn off my camera and stop sharing, and we'll turn the session over to you.
Okay, I need to share my screen. Can you see my PowerPoints?
Yes, we can see them. They look great.
Thank you very much. Thank you very much for that introduction. I appreciate it. And I'd like to note that I presented at the Medical Library Association meeting in Detroit on how we formulated the new clinically useful journals list, which is a revision of the core clinical journals list. We have published an article on that, which just came out in the Journal of the Medical Library Association in July. And you can take a look at our article for some additional information on how we develop the list. What I'm going to focus on today is how you can use the list and where you can find it. I'll spend a few moments explaining the impetus for the new core clinical journal to clinically useful journals list. We renamed it because it's a new list developed with new methodology. I'm going to give you the citation and location of the new list, its accompanying article, and it has 8 appendices, which have also useful information. I'm going to describe how to implement the new clinically useful journals list in your institution and all the different things you can do with it. And then I'll also discuss why you might want to use it. We did a research study at our institution which found that from the core clinical journals list, only 30% of clinically used articles were from the 50-year-old core clinical journals filter, and only 16% of clinically used journals were represented in core titles. That gave us the impetus, and the National Library of Medicine the impetus, to revise the list. A joint committee was formed under Medical Library Association auspices with NLM to begin to devise a process to revise the list. So that's how we decided to revise it. The process looked not just at the journals on the list, but also what subjects needed to be covered. We based the results on usage of journals in clinical environments. So it was not an opinion piece, not a consensus study. It is data-driven with real-world evidence of what journals are used clinically in hospitals and offices. There were over 800 different sites and over 1,600 different journals evaluated. Here's our journal published in JMLA. It is called PubMed's Core Clinical Journals Filter, redesigned for contemporary clinical impact and utility. And you can see all the different appendices associated with it. The actual list of journals that were selected for this new list, and there were 241 of them, so it's a bigger list, are listed in the article itself. So they're not hard to find. If you like to see the list, see what's on it, use the list, it's there. There are some other very interesting pieces of this in the appendices, most particularly the last appendix, Appendix H, which has our newly developed list in a PubMed search string that you can use to copy and paste it into your PubMed. We'll go on more about that. You can find our article on PubMed. It's there already. You can either click on the DOI to get to the article, and you'll see it in the format that I just showed you, or it is also in PubMed Central. To get to the appendices, you need to scroll to the bottom of the article. So for those of you who haven't heard my talk about how we formulated the list using real-world data, you can read the article in either of those methods. Here in our article is the list of journals that were selected for the new list. And you can see it's readily available within the article itself. And you can see it in alphabetical order. Here, we have a subject listing in an additional appendix that we have. I think it's Appendix F. But to find the list in alphabetical order, you can find it very easily and very readily in our article. You would like to save the new clinically useful journals list in PubMed. I've listed the steps. You would need to log into your My NCBI account, find our article, and find Appendix H, which is the search string that Michelle, another Michelle, we'll get there, translated it into a PubMed search strategy. So you would then copy the entire 2-page search string without the Appendix H heading and paste it into the query box. Page 2 of that was designed without the heading to make it easy to copy and paste it. When you click on search after pasting it in, the retrieval should be over 3 million articles. This is, of course, just the search string. Then click on Create Alert, name the search, for example, CUJ filter, click on No for updates, then click on Save. And I'll show you what this looks like. To use the CUJ filter, go to your My NCBI dashboard and look for it in your saved searches. Click on it and run it in PubMed. And then you would end the CUJ filter with your final search set. So what your topic is and what you've run, and now you want to get to clinical journals for that topic, you would take your final search statement and end it with the filter, then add in any left sidebar limits such as year or article type. They're all English language, so you wouldn't need to add in language. Here's a bit on what that looks like. Here's Appendix H, and this is with very appreciative thanks to Michelle Matiszewski, who is the medical librarian in Ascension, Wisconsin. And she did the translation of the journals we selected for the list into a PubMed strategy. We thank her very much. And this is what it looks like in Appendix H. So you can see here, I have copied it, both pages, and did not copy the header. And I pasted it into the query box for PubMed. And I have done this. And then I clicked on search. And once I have done that, I want to save it. So then I clicked on Create Alert. up here at the top of the screen. And this is what comes up. And I named it CUJ filter for the name. When it asked me, would I like email updates of the search? The answer is no. And then click on save. And that's how you can save it to your My NCBI account. And that's the full filter. This is what it looks like in my saved searches. This is my NCBI account. And you can see it there for me to click on and use whenever I need it. Called it CUJ filter. Here's my search strategy. It was on breast neoplasms and chemotherapy. And then I ended it with the CUJ set. And then I took that and used my left sidebar limits to limit what years I want to look at. And then I limited it to an article type, in this case, reviews, and came away with 17 drilled down articles on my topic. You can alter the sort to best match or most recent, whichever you would like to have displayed. When we did our project, we found that there were journals debuting for the first time on the list, which were #1 in usage for their particular subject. So for instance, in communicable diseases, we had the journal Clinical Infectious Diseases now being added to the list, which was previously not on the list. And it debuted at #1 in its subject of communicable diseases. So it's on the CUJ list, was not on the core clinical journals list, and it's #1 in clinical usage in its subject. All of these particular debuting journals I added to one of my filters, but I thought it was very interesting to see what had not been available before. There are lots of ways to use the new CUJ list. You can save it in a Word document. If you can put it on the institution's desktop, that would be great to copy and paste as a search string into a search strategy. You can email it out in a library newsletter to save it into patrons' My NCBI accounts. And Michelle did that for her library newsletter in Wisconsin after translating the strategy for us. There's someone else who's going to incorporate it into healthcare students' class assignments to help them narrow down their projects to find clinical or hospital-based literature. And they've already did a little trial with that and found the list was helpful for having students do that. You can use it for your own clinical queries. You can end it with PubMed's trending articles for an alert on trending clinical articles. And I'll show you how to do that. And you can customize the search string from Appendix H for your institution's services. So I'll explain this a little bit more. At the bottom of PubMed's landing page, you can see more trending articles. They give you a few and then say see more. And you can click on that and then and it with this clinically useful journals list. There were about 1,000 trending articles. When I ended it with the list, I got 116. You'll see that it covers a lot of different years. I guess there was an old hot topic or maybe some procedure they're reusing. So you can alter it for the years that you would like to cover. And you've got a trending clinical articles list. That way, might be useful for a newsletter. And here's another look at some of the articles that were available. You can customize the clinically useful journal search string from Appendix H for your own institution's needs. If you don't deliver babies, you can omit the OB/GYN, fetal, or neonatal perinatal journals. If you don't transplant organs, you can omit the transplantation journals. If you don't have pediatric or perinatal services, you can delete those journals and leave it more towards adult medicine. If you're a psychiatric facility, you can create or use a behavioral medicine subset, which I've created for this presentation. The list has more behavioral medicine journals than the old core clinical journals list. So we have a little deeper dive into mental health and behavioral medicine. If you're a pediatrics hospital, you can create or use the pediatric subset, which I've devised for this. If you want a focused nursing subset, we've got 10 nursing journals that were included on the list based on usage. Here are the example subsets, some of them, that I've created from the full set. So there's a behavioral health set, there's a nursing subset, there's the pediatrics set, and gynecology, obstetrics, neonatology, and sexually transmitted diseases subset. In addition, I created a subset of adult medicine, which does not include pediatrics or obstetrics. Plus, I made a list. I'm calling this the ACEs list. These articles really aced it. They were our top scorers above 5,000 uses. And they also included the subject top scorers. So those ones that debuted at number 1 on the list, they're included too. The ACEs list is, I'd say, comparable in size to the original core clinical journals list, being slightly larger. It's about a little over 130 journals, whereas the original list was 119 journals. So if you're looking for something that is as narrow and tight as that list was, this ACEs list will provide that kind of a subset. And of course, you can create your own subset, which is part of the beauty of the list. You can create a custom filter. You can't do it with the whole clinically useful journals list because there's a limit of 4,000 characters. So that the list is too many characters to be saved as a filter, but you can create a filter for other topics that are part of the subset. And to do that, in your MyNCBI, you would go to Filters, and click on Manage Filters. And then when you get there, you would click on Create Custom Filter. And when you do that, you would put in the search string and save it. In this case, I have put in the neonatal perinatal string, which is small enough, and clicked on Create Custom Filter, and I activated it. So I now have a clinically useful journals filter with pediatrics. And then it appears on my search screen as one of my filter options. You can see it here, CUJ Pediatrics set. And when I ended it with a topic, in this case, COVID-19 drug treatment, I got down to 53 articles that from over 12,000 that relate to my topic of COVID-19 drug treatment. And my grandson just got COVID. He's 4 years old. So this is an example of saving one of the subsets that's less than the 4,000 characters and saving it as a filter and have it appear for your use. So you can just delete subjects you don't want to cover. If you have a center of excellence within your institution, say the Heart and Vascular Institute, the Oncology Center, the Vision Center, you can create a specialty filter for your centers of excellence within your institution using the search string and then saving it as, for instance, a filter. There are a lot of reasons why having a new clinical filter is important. It increases search efficiency. Over 80% of searchers' clicks are among the first few pages of their retrieval. Therefore, the most clinically used journals need presented first. So I mentioned we analyzed 1,600 journals. When we went back and saw how many of our selected journals were on that list, 85% of them accounted for that 85% of the usage. So they were actually being used. By improving clinician efficiency, we have found that we could have impact 80% of the physicians in the US, UK, and Canada, because that is the percentage of physicians in the 3 countries that search PubMed. So the potential impact of having this clinical filter is very strong. Our filter was not oriented just to physicians, though. It has a much broader clinician focus. That was another one of its strengths over core clinical journals. But just in terms of saving physicians time, 80% search PubMed. And it could increase the frequency of evidence-informed care by bringing clinically used journals to the forefront of your retrieval and clinicians' retrieval. So it makes sense to have a clinical filter to speed up retrieval. Here's Appendix F, what it looks like. It is a collection development tool as well. So say you're looking for another journal in cardiology, you can look at this list, and these are classified using mesh broad subject headings, which is 125 mesh headings that are broader in scope, but encompass all of medicine. And you can see in Appendix 6 how much clinical use did that particular journal have. So you can see circulation versus Journal of the American College of Cardiology, and see how much actual clinical use based on these 814 sites did this particular journal get. And there's the NNMID, so you can make sure you're honing in on the correct journal if titles are similar. Studies have shown that PCPs generate about 10 to 15 questions per day. Answers to 2/3 of these are not pursued at the point of care. And if answered, almost half would have had a direct impact on patient care. So clinical questions are common, important, but they often go unanswered. Maybe with a new clinical filter, more of these questions could be answered so that evidence-informed care can be increased. What questions do you have?
Well, Michelle, we've had quite a discussion going on in the chat. We do
Okay.
have one official question that has come in through the Q&A link, so I'm going to start with that one, and then I'm going to parse out some of the questions and comments that we've had coming in.
Okay.
So one question that was asked is, can you actually make a custom filter, and that's custom filter in quotes, so that you could use it under my NCBI filters? When I tried, I received this error from PubMed. Custom filter core clinical journal is ignored because its expression exceeds 4,000 characters.
Yes. So the answer to that is you cannot save the whole clinically useful journals list as a filter because it does exceed their 4,000 character limit. I do not know if at any point, maybe the National Library of Medicine will make it available as a filter. And that is still needed because the list does exceed their limit of 4,000 characters. So the whole list cannot be saved as a filter because of that limit. You can create a subset, and depending on the size of the subset you create, it can be saved as a filter, as I did with the pediatrics. But the whole clinically useful journals list exceeds their 4,000 character limit. So the answer to that is unfortunately not.
All right, thank you. And I know there was some sharing in the chat about that limit and ideas for changing that and shortening it. And there was also quite a bit of discussion with questions from people who asked if PubMed does have plans to formally add this as one of their PubMed filters. And to the best of our knowledge at NNLM, I think it's similar to the instance that we had with the nursing journal filters, that it's a maintenance issue that gets presented over time for keeping that up to date. But Linda Walton, who is the executive director for Region 6, did share Diane Babsky's contact information in the chat. She recommended contacting her team because that's the team that makes the decision regarding filters. So
that's great. I I think that maintenance would not be a big problem because a lot of what we did could be automated in terms of collecting the information on journal usage. And we revised the subjects, which would not need revised again, I'd say, for another 10 years, 15 years, because man doesn't evolve that fast. So I think evaluating the subjects to cover on the list would not need done very soon. So I think that a committee could collect the data and evaluate it, having a roadmap now in the article that we did. And we've got a statistical appendix, which shows the statistics that our statistician ran and how she created our correlations. But again, a lot of that wouldn't need done. Just the journal usage data would need to be collected, assigned a broad subject heading, and then evaluated just in terms of the clinical usage. And now there's a roadmap as to what to do. Before there wasn't. So I think it could be simplified and maintained without a great deal of difficulty.
Thank you. Yeah, thank you, Michelle. I know that there was a recommendation to include any messaging to Diane, easy management through automation. Just making sure that's mentioned. We did have another question come up that is pertaining to that 4,000 character limit. What if you use the journal IDs to create the filter? Is that over 4,000 characters?
You know, that's a great idea. We haven't tried that. And boy, it just may work. That hasn't been tried. And that might work. All of the IDs are available. So we'll have to try. We haven't tried it. That's a great idea.
We did have one comment come in saying that they don't think it's over 4,000. The original list is over 6,000 characters.
Yeah.
Yeah. There was a question earlier in the chat, and it was about one of your instructions or strings, and it was, won't and-ing together this long CUJ search string create the potential for search errors in PubMed due to longer search strings than what PubMed allows?
I have used the search string several times, and it takes a couple of seconds for it to chug through. I have not had it reject my search string for being too long. I do systematic reviews, and I have search strings that go on for more than a page. And I haven't had it reject my systematic review search strings, which can get equally as large, if not larger. And I haven't had that problem. So I don't think that will be a problem based on my systematic review searching.
And then, Michelle, there have been several comments about how, about the instructions and the subsets that are genius as well. That's the quote in there. And wondered if you'd be willing to share your PowerPoint slides when we share the recording with everyone who registered for this session.
Yes, I'm more than happy to share the PowerPoints. Plus, I'm putting together all those strings in a Word document, which I can send to you, Erica. Probably won't get to be able to do it today because I have some other responsibilities, but I can send you that Word document with my strings in it. And that would be great if you shared them. People would have some of those subsets.
Yeah, fantastic. That's easy to do when we share the recording, and we won't have the recording available today, so that's fine too. So
Oh, good.
we can work with you on that.
Great.
We've had a lot of comments about your wonderful presentation, and folks look forward to diving deeper via the JMLA article. So thank you for that, and thanks to you and all your team for the great work, because there's so much useful information here.
Well, there's so much that can be done with the search string that it really enables people to customize it for their own institutions. And I certainly would also love to see Diane and her group consider making it available as well. But customizing it in so many different ways is one of the beauties of the flexibility of it.
Let's see, Michelle, I may need to have you stop sharing before I can share.
Okay.
But I will just put
Okay.
up the evaluation link, and we can certainly keep the conversation
Okay.
and the questions coming while I just post this up on the screen.
Okay, I stop sharing.
All right, and I think everyone should be able to see that evaluation link now for this session. We can try to get that posted in the chat too for you. Yep, Miles just did that. And that usually works best if you copy and paste it into your browser rather than trying to click on that direct link. And again, many thanks to Michelle, who's willing to share some additional information with everyone who attended today, and we'll send that out with a link for the recording. Okay, I'm not seeing any more questions right now, but we can definitely, we'll have your contact information, Michelle, right, with the PowerPoint slides that we share. Yes. So if other people have questions as they dig through your article and start using your search filter, they'll know how to find you.
Yes, that sounds great. And
all right, well, thank you so much for the presentation. Thanks everyone for attending and for having the interesting conversation going on in chat and helping everybody with there was a little troubleshooting that was going on in accessing some of the appendix information, and they all helped one another while that was going on here. So thank you. Have a great rest of your afternoon, everyone.
Thank you for the opportunity.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.